when your team member, in our case, we have a new patient coordinator that does the first 30 minutes of the new patient. And she's doing that with the new patient. She's doing four things. She's doing a quick tour. It's a little 3 to 4 minute tour of our practice. And the purpose of the tour is to give them a welcome to our office and to subtly let them know what's available without selling. Secondly, we do an interview in the consult room, 7 questions. And in those 7 questions, we learn the patient's dental story. And everybody has a dental story unless they're 2 years old. The third thing they do is they take the 6 digital photos for patient education. We take Frank Spear's series of 6. And then they take necessary records, which could be bite wings, full mouth series, digital panoramic x-ray, or could be CBCT if they're missing a tooth. And all that happens in the first 30 minutes. Then the patient's in the treatment room, the new patient room, and they're meeting the doctor for the first time. And I'm going to show you how we apply the concept of liking. Our new patient coordinator will share something with Dr. Paul or Dr. Tim about the patient that has nothing to do with their teeth. So we'll say, Linda, this is Dr. Paul. Dr. Paul, this is our new patient today, Linda. And now she'll share something. She might say, Dr. Paul, I never thought I would find anyone as interested in mountain biking as you, but I actually think that person might be Linda. Linda really loves mountain biking. And now, so she shares something about the patient with Dr. Paul. Now, what Dr. Paul is going to do is spend 90 seconds, a minute, 2 minutes talking to the patient. In this case, what's he going to talk to Linda about? Mountain biking.
Mountain biking, yeah, because there's something in common. They both like mountain biking.
And it's a great way to start your relationship. It's have nothing to do with teeth. And instantly there becomes rapport, there becomes comfort. You can see it in their facial expressions. And it could be something really simple. It could be, Dr. Paul, Linda has a 6-year-old little boy just like you. Oh, wow, what's his name? Then they'll talk about their 6-year-olds. Could be Linda works at Fender Guitar with our patient Dave, and they both work together in quality control department. Oh, wow, how long have you been at Fender Guitar? And they talk about the commonality we have. We take care of a lot of patients that work at Fender Guitar, including their CEO and many of their staff. And so we talk about that. And nothing to do with teeth. And instantly the anxiety and all the normal, challenges that a new patient might experience in an unfamiliar place, all that stuff melts away.